Hey Anna, so thank you for coming in today. I see that you have a radial nerve neuropathy on your left arm. So today we're just going to talk a little bit about the treatment plan that I'd like to do with you today. So the goals for today is mostly going to be like introducing my touch as we haven't worked together before. And I also just want to check, like do a little bit of like a tapping assessment to see where the nerve has regenerated since your surgery. Just to so we can see where it's at and go from there for treatment. Um, so with the treatment today, you have a little bit of edema present, so I'm just going to try and clear out more of the fluid today, focus on your specific arm to clear that fluid out. So next treatments, we can do more like facilitation techniques and overall like decreasing contractures in the unopposed muscles and stuff like that. So today, yeah, we're just going to be clearing out the fluid in your left arm. So it'll be a little bit of fluid work in like right up here, just to clear out fluid here, and then working upwards to clear that fluid out. So it's mainly going to just be a pretty specific treatment to the arm today. So for the areas being draped, so everything will basically be completely draped, only from here up will be undraped, so your arms will be out. I'll tuck the sheet underneath the sheet as well, just under your arms, so then the sheet is nice and safe, so everything stays draped. And then you'll also be laying on your back the whole time. I'll put a pillow behind your head and elevate your arm a little bit. We'll also be taking you out of that neurological posture. So you're sort of in this position. We're going to take you out of that just to help relieve some of that posture, and so I can treat the muscles accordingly. The main thing that we're going to be like making sure that I'm very like conscious of is not like tensioning the nerve or like pulling, like doing any sort of like this like stripping sort of movements or like stretching the nerve itself, because we don't want to tension the nerve as it is regenerating, and we want to ensure that the nerve is safe and good to go and can continue to grow in a safe way. And with that, we won't be doing any sort of like neck stretching either, as it is growing in this direction. Also, so if today you decide not to go through with treatment, I will give you a heads up that not getting treatment, there won't be any change regarding your condition. So the nerve will continue to regrow. However, there may be a little bit of more of a disconnect with the actual like mind to muscle connection as it is regrowing. So overall, like progression and like muscle atrophy may progress a little bit more if you don't work on those sort of areas. Also, the like unopposed muscles, the unaffected side of your arm, they can really start to contracture and get really, really short. So then which can lead to some more like shortened muscles and overall like pain sort of in those areas. So we really want to stop those, work on those areas, stretch them out a little bit, and then facilitate the overall like atrophied or loss of like affected side of the muscle. For the entire treatment, I'm just going to be checking on your comfort, how you're doing, seeing if everything's okay. We'll check in with like overall like sensation, see where your sensation is impaired, and in those areas we'll be very like conscious of that. And at any point, for any reason, if you want to stop or alter the treatment, please let me know, and I will do so immediately. This is for your benefit. You are in total control. Whatever you want to do, just let me know, and I will absolutely accommodate you in any way that I can. Do you have any questions for me so far?
Yeah, do you think I'll be stuck in like the same position forever?
So currently it is still early in the regeneration process, so I can't say for 100% certainty what your progression will look like. I will be completely honest, nerve regrowth is very long and it can be a bit of a hard process as you are stuck in a position you're not normally stuck in. But however, they do continue to regrow just at a slower rate, and doing facilitation techniques and stuff that we're going to be working on today, if you decide you want to go through a treatment, that can definitely help with the progress and ensure those neural pathways are still working appropriately, and so then your progression can maybe potentially be a little bit faster, and once the nerve has fully regrown, you won't need to do as much rehab potentially to restore those overall pathways. So I can't say 100% certainty, but it does take a little bit of time for the nerve to regrow, but you shouldn't be entirely stuck like that, but I can't say for 100% certainty. Does that make any sense?
Yep.
Okay, did I answer your question appropriately?
Yes.
Okay. So I was wondering, so for the treatment specifically today, do I have your consent to proceed with that treatment?
Yeah.
Okay. So I want to, if you're okay with it, like do a little bit multiple treatments just to continue to help the overall neural tissue of your radial nerve as it regrows during its regeneration process. For subsequent treatments, since we will have like cleared out any edema, we're going to focus more on those like facilitating those atrophied muscles and really like carefully stretching out those unopposed muscles to keep them from being contractured and staying in that shortened position, which could lead to worse shortened muscles and contractures later on, which we're trying to avoid. So that's what I want to do for more of those treatments, and continue, facilitating those muscles, trying to get some regular tone back into them, and so really continuing to keep that mind-muscle connection to maintain those neural pathways as the nerve regenerates, so it's easier to do, like as the nerve is regrowing, easier to continue like progression and having those muscles not be as weak or inhibited from the lack of nerve connection. So what I'm thinking is each treatment will be about 60 minutes, because I do want to add the like unaffected arm and then some shoulders and neck as well, just to decrease all tone in those sort of areas, so we don't have any sort of, as these will be compensating for the overall decrease in mobility of this arm. So we want to just ensure that everything is working smoothly and succinctly together. We would do this about once a week for 5 weeks. We're going to reassess in week 3 and week 5. The reassessment will kind of look like whether we're going to see if progress is being made and if like the facilitation is working, see how your actual like mobility has been progressing. We're also just going to continue to see where the nerve has been regrowing to make sure it's still on its proper path and still regenerating as it should. So I will be giving you some remedial exercise for these. So they're going to be called engrams, and they're basically just doing like a certain action that that muscle is used to doing, just to maintain that neural pathway and keep those connections flowing. So the one I'm going to be getting you to do is it's going to be like you're trying to push like a heavy door, like doing it with both arms, pushing it with a heavy door, and also like when you're standing by the sink, just like brushing your teeth or something, just like pushing lightly on like your vanity, just to sort of be in this position and activate those muscles as you're doing it. And like while you're doing the engrams, you're really going to start thinking about like, okay, like I'm really facilitating that muscle, getting that mind to muscle connection. But we will also be talking to that more like after treatment and everything like that, just to make sure you have all the knowledge that you need for it. If after reassessment it doesn't seem like we're making a lot of progress, I'll probably refer you out to a different like healthcare provider. You're probably already seeing a neurologist and your neurosurgeon as well, but if more like rehab's needed, we can refer you to an occupational therapist or a physiotherapist as well, to give you more of those really nitty-gritty exercises to help maintain that neural pathway and overall tissue integrity. So for this series of treatments, do you have any questions for me or anything like that?
No.
Okay. And would I have your consent for the treatment series?
Yes.
Perfect. Thank you so much.